Welcome all. So today my video is on obsessive compulsive disorder or OCD. Now OCD is a very common mental illness. The literature says that almost 2 to 3% of our population suffer from OCD from some point of time in their lifetime. So what is OCD? Obsessive compulsive disorder is actually composed of two parts: obsessions and compulsions. Now, what are obsessions? Obsessions are some intrusive thoughts, doubts, impulses, or urges that comes by itself to a person. The person can feel that it is intrusive, that it is intruding all the time. The person does not want to think of these things. The person wants to get rid of these doubts or thoughts by different methods. He or she may try to do some activity to get rid of it, or may try to distract himself or herself. But again, the thoughts will come back to him or her. So, this is obsession. The person can completely understand that it is fully irrational, unwanted, and is happening in excess of what is required. And what is compulsion? Compulsion is actually repetitive acts or maybe some rituals which are mostly done in response to obsessions, but there may be instances also where they are happening without a particular obsession. For example, let me tell you, the most common example of obsessive compulsive disorder is frequent hand washing. A person may feel that his or her hands are dirty, some dust or dirt might have touched him or her, so the person washes his or her hands. But probably, even after washing for a few minutes, the person may again feel that my hands are not enough clean. So maybe he or she has to repeat the whole process again. So here the obsession is the doubt of being contaminated, or of that some dirt has touched me, and the compulsive behavior in response to that is repeated hand washing. So this is just one simple example. So now I'll elaborate on the different types of obsessions and compulsions. The most common, number one, is the doubt of dirt and contamination, which I already discussed, which I already told, that there will be frequent hand washing. Now, there may be some ritualistic behavior in this washing of hands. It may be the person may start to wash maybe the fingers or the arms first. He or she will probably wash it a particular number of times in a very ritualistic manner, and then proceed to rest of the body organs. Now, if the person gets distracted in between, he or she may again start the whole process once again, because he or she may feel that the process was not correct because some disturbance happened. So if I don't do this many number of times, it will be problematic. So he or she may start it once again. The second one is the doubt of checking. The obsession of checking. The person feels that he or she has not put the door lock correctly or has not switched off the gas knob correctly, and so has to repeatedly check it. A person may feel compelled to count money a number of times. Even he or she knows that this amount of money is there in my drawer, but again she or he has to repeat it multiple times. It may happen that a person, while going out, has checked the lock of the door properly, goes to some distance, and again comes back to check it once again. The third common type of OCD is the type of OCD which happens in some aggressive. The person gets repeated images of some aggressive behavior, or maybe some sexual images. That means a person gets images of maybe some very known family members in a very socially embarrassing position or picture of that. He or she may see God, or whenever they go in front of God in temple, they may visualize, they may get the image of God maybe naked or something like that, which is very embarrassing for the person to tell also. This is, the person can completely understand that he or she is not enjoying it. This is simply coming to his or mind, but cannot get rid of it. And to overcome this, he or she may repeat the name of God 1,000 times. But again, the thing comes back to him again and again. The last one, which I would like to tell you, is some obsessive impulse or urges. The person may feel that probably some obscene languages probably have been blurted out by me, or I might have done some physical injury or hurt to somebody, and then the person will seek reassurance from others whether I have done anything, whether I have blurted anything obscene like this, or whether I have blurted anything abusive words, anything which should not be spoken like this. So this is the fourth common thing. Lastly, I would like to mention about hoarding disorder. People, they cannot they cannot discard old used items. They feel at some point of time I may need some information, so I can't dispose of old books and newspapers. As a result, what happens? Their houses may get cluttered with old objects, old books, etc. It may also lead to such an extent that the person may get injured from these things falling on him or her. This type is called hoarding. Now, I would like to mention two things. One is accommodation and one is proxy compulsions. Accommodation is when the family members, they accommodate the behavior of their patients. Suppose a person is washing their hands repeatedly, his or her hands, and he or she is using maybe 1 or 2 soaps per day for washing and using lots of water. Family members, what they do, they will buy soaps for him. They will fill up the water tank multiple times, because they feel if they do not do this, the patients, they will get more irritated, more troubled, so they accommodate that behavior. Now, this is one of the treatment principles that we tell patients, their family members, that they should stop accommodating these behaviors. The second one, what is proxy compulsion? Many a times the patients themselves, they do not do the compulsive behavior themselves, but they compel their family members to do it. For example, they may tell their family members to arrange the curtains, to arrange their belongings in a particular way. Or they may tell their family members how to wash their hands, how to wash which object, how many times, all these things. So this is proxy compulsion, when the compulsive behavior is being done by their family members. So now I come to the end of my discussion. I would like to tell you what are the things which are not obsessions. Many a times we hear people telling that I am obsessed with music. This is not actually obsession, because a person enjoys music. When a person enjoys music, that cannot be obsession. Obsessions are those which the person does not enjoy, and they come to the person which is the person wants to avoid, then it comes. So music is something the patient loves, the person loves. This is not at all an obsession. The second is, suppose somebody has sat for an exam, and then waiting for the results. That time the person will repeatedly get the thought, how did I fare in my exam, what did I write, what did I miss, these things. This is also not an obsession, because the person wants to think about these things repeatedly. It's not that it's intrusive and it's irrational. So that's it. I have given my contact details in the description box. I will be very happy to answer any of your queries regarding OCD. Kindly let me know through the comment box what are the topics you would like to listen from me through this video discussions. And kindly like and comment on my video. Kindly share this video with others, and please subscribe my channel. Thank you.